My name's Rebecca Helliwell and I'm the clinical lead for NHS Highland. I work as a GP in Lochilphead, and below me you can see the community hospital where I do a lot of my work. There we provide emergency care, inpatient care, chemotherapy and end-of-life care for our patients. And that's about keeping patients local at times in their life when they're most vulnerable. It's about not taking them away from support networks and friends when they really need them most. But it's more than that. It's also about not using specialist resources for patients who don't need them, so that we can save them for the patients who really are in need of the specialist service that Glasgow provides. So realistic medicine, I think, is about a lot of similar principles. It's about treating patients as people rather than a collection of diseases, and it's about taking their views into account when planning their treatment and planning care together. But it's more than that. It's about using the scarce resources in the NHS more wisely to free up better care for whole populations of people. So across NHS Highland there are a lot of projects that already embody these principles. Near Me lets patients come to outpatient clinics more locally rather than having to travel long distances where they feel uncomfortable. There are also lots of projects going on to do with spending and allocation of resources on drugs and other expensive items, so to free up more resource for whole populations of people. And also lots of individual projects looking at involving patients in decision making to do with their care. So we're already doing a lot of the types of things that realistic medicine would embody, but I think it gives us a vehicle and the rationale for doing these things, and it helps us to explain to patients why we're working as we do. So over the next few years we're really looking forward to embodying all the principles of realistic medicine more widely across Highland and keeping it at the very core of our activities with our patients all across the patch.